I'm so happy to be doing this. Welcome to the show. We're gonna have some fun.
Yeah, thank you for having me.
Yeah. So listen, I know your history. My audience doesn't, and I really want to make sure that we understand where people are coming from before we jump in. You're a medical doctor, and you saw the light. You see things differently. So just give me a little bit of your history so that we can dance.
Yeah, for sure. You know, I graduated from medical school 30 years ago now. It's a long time aging myself there. But for 20 plus years, I was a surgeon and I did surgery, a lot of surgery. I started off doing trauma and general surgery for 10 years. I got tired of that. And then I moved on to reconstructive surgery. And then from there, I also became an entrepreneur. I bought surgical centers and opened surgical centers in the Central Valley of California and Temecula, close to you, and a few other places. And about 10 years ago now, I found myself being a Western medicine doctor, but still very sick, And so the reason I say sick is because I was stressed out. I was working 18-hour days, 7 days a week, and found myself not just being overweight, I was like 50 pounds overweight, but also I had an autoimmune disease, high blood pressure, diabetes. It's like 6 named diseases, And then when you're on 6 named diseases, you can do the math and figure out how many
20
pills
drugs,
I was
right?
on. Right, exactly. Like 15 different pharmaceuticals. And just found myself really sick. And at that point in time, decided to because of the birth of my son, actually, there's always like some event that happens that makes you really look at yourself in the mirror and say, I need to do something differently. It was the birth of my son that made me realize I need to get healthy because, I'm a little bit older dad. I was 42 when I had my first child, and I wanted to stay alive long enough to see him grow up. And so I decided then to dive into the science of health just because I could not find in Western medicine anything to get me healthy. It was just more pills, procedures, etc. And I said, that's not the way I want this to go. I wanted to go a different direction. And I was mind blown because first I started with nutrition, and I decided I need to learn about nutrition because in medical school, you learn about nutrition 0, right? And so that opened up a whole world of learning about functional medicine and health and exercise and sleep and all of it. I got myself healthy within 8 months. And then I said, I need to change my career because it's the kind of medicine I want to practice. I want to use my Western medicine roots, but tie in the integrative functional side to this and bring it together because that's where the real magic is.
I love this.
Yeah.
Do you have peers that were like, wait, what? Right? Like at the time? Yeah.
Every one of my peers was like, what are you doing? And so some of them got like almost very like combative with me. Like I was doing something that was
sacrilege.
Sacrilege, or just not being based in science, or doing something wrong almost. Like, and I said no. Look at me. And plus, at this point now in my surgical practice, I was talking to dozens of people on a weekly basis, telling them what I was doing, because my patients would notice, like I looked so much better. I had more energy, more happiness. They could tell, better aura. And they said, like, what are you doing? I would tell them. I'm like, look, this is what I do in my diet. This is how I started focusing on my sleep. And they got better just by listening to little bits of advice I would give during my consultation visits. And they're like, they avoided surgery. Like they had to cancel their surgery because they got better. They didn't need surgery.
Did you have business partners at the time? Like, dude,
Yes.
you're bad for business.
Yeah, it was bad. It was definitely bad for business.
Yeah.
But you know what? Like when you find something that really works, you want to do it.
It's a different model.
Right.
It's a different model. Like, hey, you could stay here and we could cut and we could do a lot of stuff and your insurance is going to pay for it. And once you kind of spring that trap,
yeah.
what do you mean you're getting healthy? What do you? And so at that point, 8 months of a transition. At this point, just tell people how you felt. Like, I mean, energy.
Look, when you change your entire life that you've been living for 25 years and 8 months, it's a huge deal, right? Psychologically, physiologically, sociologically, all of it. And so it was a rapid and crazy transition that physically I felt really good. I felt like I had my energy back again. I felt the best way to describe it is vitality. Like you get your vitality back. Like you want to wake up every morning ready to attack the day. You can go to sleep every night and 10 minutes and sleep all night and feel incredible. You can't put weight on even if you try. You can't wait to like get to the gym every day. Like these are all feelings that everyone should have every single day, I feel. But also, it was a massive, I would say, life transition too, because, I just had my son and my daughter came soon afterwards. And so I was going through major life transitions, family, career, what I found was that I added a lot of stress to my life, but I was so much better equipped to handle it, So
You mentioned this big life transition, and there's this point, right, where the pain of getting better has to be outweighed by the pain of staying the same.
yes.
And you had an emotional quality to that, to saying, I'm not going to be here for my kid.
Right.
Like, how did that moment shift you? Because it's so hard. I mean, this is the elixir in medicine, right? Is getting someone to be like, okay, I'm going to do this, right? Because you can't do it for them. Was it overnight? Was it over a couple weeks?
It was exactly at 10:35 p.m. on December 2nd, 2013.
I love that. Like a decision, a conversation.
Here's what happened. My son was born around 9 p.m. It was a planned C-section because we saw that the cord was wrapped around his neck. And so we did a C-section, and then he was born. Everything went great, thank God, and wife, son were in the recovery area, and 10 o'clock, like I was no longer needed for anything. So it happened to be in the same hospital where I do my surgeries. Okay. So I was like, it's 10:15. I have nothing to do. So I'm just going to go down to the doctor's lounge, see if I can find a donut or something to do and just chill. So I go to the surgeon's lounge, and there were donuts, like left over from the morning, of course. And I see this journal on the coffee table that was open to an article that had the title of the article was something like mortality rates for autoimmune disease and other comorbid factors. Comorbid means like other diseases, right? And so this was me. Like I had just developed an autoimmune disease like the year before. And I was like, oh, that's me. Like, let me look at this. And so I turned the pages. I find this chart, and it's like, autoimmune disease plus diabetes, hypertension equals 50% mortality in the next 20 years. I was like, 50% mortality in 20 years. So I'm doing the math. My son would be 20 years old. He was just born an hour ago. I was like, oh, I have a 50% chance of dying before my son turns 20. It's like my heart dropped into my stomach, when I saw that. I was like, what the heck am I doing? Like, this is ridiculous. And I knew that I had to do something, but what I thought I had to do was get on a better immune suppressive medication for this autoimmune disease. It was.
Were you holding a donut at the time?
Yeah, I was holding a donut at the time. As a doctor.
So good.
As a doctor,
Yeah.
right?
Yeah. Okay, so 10:35 strikes, and you're like, okay, I'm no longer doing this.
Yeah.
What is that? What do those 8 months look like? Like, because people are afraid of like, oh my God, I got to change everything. How does this roll out?
Total confusion and disappointment, and just like a feeling of just being defeated for like 3 months. So what I did was next day, I call my doctor buddies. I'm like, hey, like I got all this going on. What should I do? Like, I don't know. Like, I'm sure there's some new medications out there. I call my primary care doctor, and, I'm a doctor calling my primary care because I'm a surgeon, right? So I haven't done primary care in a long time. He's like, let me refer you to this rheumatologist. Let me refer you to this, to this cardiologist, because I also had like plaque developing in my arteries and stuff. And so I was like, okay, forget it. I'm just going to throw some money at this problem. So I hired a concierge medical doctor in Beverly Hills. Okay. So like, I'm thinking this is the more money I spend, the better treatment I'm going to get. Right. So I think I spent like $20,000. Like it was a lot of money. I go see this guy, and he he does a bunch of blood tests on me, sees me in his office, and he's like, all right, yeah, you were right. Like, we need to get you on a better immune suppressive medication. There's this new category called biologics coming out. And we need to get you on a new hypertensive medication because your blood pressure is not controlled with the medications you're on. So here's a new one that just came out. And then, I see that you're really depressed about this whole situation. So I'm going to put you on Prozac too. And so that was a solution my $20,000 got me.
Oh my God, more of the same.
Yeah, more of the same. So it's like probably 3 months of just like struggling with all of that.
You took his advice because you paid for good advice, and he gave it to you, and you're still living under that thought field of this is what we do.
So I did not take his advice.
Oh, you went AWOL already.
I went AWOL. I was like, I'm not doing any of that. That's bullshit. And so so I was like, I know my nutrition is a problem, but I thought I'd solved it by, this is when all the talk around fasting was coming out. So I was like, I'm going to fast. So I started fasting, and I would break my fast with like this giant coffee drink from Starbucks. Okay. That was how I would break my fast. And obviously it wasn't working, right? So I'm like, I just need to learn more about fasting and nutrition. So I did what I know how to do, which is to dive into like learning something new. And what I mean by that was I decided to just go and take a course in nutrition to get a certification in nutrition. I was like, I know, when I started doing surgery, I learned the most when I was studying for my board certification, right? So I got board certified. In that 6 months before my boards, I became probably one of the world's experts in surgery because I got one of the best scores ever on the surgical board exam. So I was like, let me do the same thing. Let me just go dive in nutrition and get a certification. So there's a nutrition certification that I got. And I learned so much. And it completely changed my life. And it wasn't just nutrition, because what happens when you start learning about nutrition, you should learn about how stress and nutrition and sleep and nutrition all tie together. It's all this interconnected web of, what we call right now health and wellness. But then I was like, I need to read this book on sleep. I need to read this book on cortisol. And then when you start learning about all this stuff, back then, 10 years ago, Jeffrey Bland, who we spoke of earlier, just was starting to teach people about functional medicine. So I was like, I'm going to now go and get my functional nutrition certification. And then they had just developed a course on functional medicine at IFM. So then I dove into that and took that. And that's what blew my mind. And I learned everything about gut health and hormone health. I found that testing myself, I had the worst leaky gut imaginable. And I had horrible hormonal levels as well. And so I fixed those things too. And so that was kind of like the journey I had to go on to get myself healthy.
Amazing. So you went under the godfather of functional medicine, learned everything, shifted your diet, fixed your sleep. And this is
my hormones. Yeah.
This is the inconvenient truth about health, right? Is you had multiple systems that you had to pull levers on.
Right.
And there wasn't, the pills weren't working, but it's like, now I got to pay attention.
Right. Right. Exactly. Right. It's the pills are just a mask of what's going on at a root cause level. We all know that, right? The pills are not curing you at all. They are masking it, and they're allowing things to get worse under the hood. But once you understand what's really going on at a root cause level, and you start fixing the root causes of disease, then everything changes, and you get off your pills. And so I did. I got off all my medication. Almost all of it within 8 months. So, dozen pills down to 1 or 2. And I lost 40 pounds in 8 months. Not all of it, but 40 pounds. And then it just completely changed everything. It got my vitality back.
Amazing.
Yeah.
Amazing. What a gift to your children and probably your grandchildren.
Yeah.
Because now you have enough vitality to kind of sustain seeing those generations blossom.
Yeah, absolutely. Yeah. And as you know, you talk a lot about methylation patterns in your DNA. Like now my DNA has completely repatterned itself, which then goes into our children, right? Like my son didn't benefit from that, but my daughter did because I was healthy when my daughter came. So those new DNA patterns go to your children, and this has been proven in science. and those new methylation patterns, and they go on for future generations.
This is where I think everything breaks, right?
Yeah.
I'll see that. It's like everything that I might have done wrong or my wife has done wrong, you see it in your kid, you're like, oh man, that was me, right? And look, it's too little too late on some, but everything you do from this moment on matters.
Yeah.
And I don't think people are trained to think that way because the model has always been do what you want, we have a pill to fix it. And that narrative just breaks, right? It breaks. Right. So now you're a guy who owns surgery centers, who has, partnerships, so people are getting mad because you're driving away the surgery business, right? Then what happens? Like, how do you transition into a different form of medicine?
So, I hired someone to just kind of maintain that business. And then I started a new clinic here in LA, in Hollywood. It was funny because it was like a 1,200 square foot clinic in kind of a back of a strip mall on Sunset Boulevard. And, this was 10 years ago. So no one was talking about longevity. Health and wellness was like kind of like going to the spa and, getting a massage. And there wasn't a lot of talk about this. And a lot of the things that I was doing, mainstream medicine was like saying was malpractice. Okay. So, and so I started this clinic where we did hormone optimization, lifestyle medicine, which is nutrition, sleep, and exercise, and just looking at people's gut with some new gut health tests, food sensitivity testing and microbiome testing. And so that's what we would do. And no one really knew what this was that I was doing, right? And so no one knew what functional medicine was for sure. Not even the medical world knew what that was. So I just called it a health optimization clinic. That's what I called it. And so obviously, like with any new business, it wasn't just a new business, it was a new model that we were creating, right? And so that's the hardest thing, because not only you have to describe like what your business is, but you also tell everyone what the new model is. And so we did a lot of educating people on what we were trying to do, getting like our talk correct so people understood what we were doing. But one thing I did differently was when we started Next Health, I decided that I wanted to completely not just reimagine how I practice medicine, but the environment in which it was practiced in, right? And so a lot of times when you go to a doctor's office, it's like on the 10th floor of a building with horrible parking, and then you walk in and it's like a tiny waiting room with like 1980 furniture.
With a grumpy receptionist.
Exactly, grumpy receptionist, like glass between you and the receptionist, right? Like you're gonna like cough on him and get him sick. So I was like, let's completely reimagine what going to the doctor is like. So one thing we did was wrote down all the things that was wrong with how medicine was practiced today. Part of it was like the mindset of treating every disease with a pill or a surgery. But the other part was it's not inspiring at all. Like you were scared and reluctant to go to the doctor, right? And so we sat down and just reimagined what that looked like. And so I used the Apple Store as a inspiration. And so I really just wanted to create like the Apple Store of health. And that's kind of what we did. And so that's what attracted a lot of people to our location, because people will come and be like, wait, what is this place? This is cool looking. What are you doing here? And then we got to tell the story of what we were doing.
That's brilliant. That's brilliant. I think a lot of the early adopters in health and wellness were, shrapnel, right? Like there was just so much education against this mainstream system. And then you had these lords in the white coats just poo-pooing it and saying that's all crap. And it was so many headwinds that I think a generation of like kind of early functional doctors didn't make it across, right? And it was tough. I know a lot of people that are not in practice. It's just they couldn't make the business work. And that's a hard part, right? Because insurance, and maybe that's changing, insurance didn't pay for this stuff, right? Insurance waits for you to break. Right. Then you give them the card, and then all of a sudden it's just like, money, money, money. They pay for all the surgery, they pay for all the stuff. But where are the incentives to keep people well? And obviously what does my insurance pay for it? Is usually one of the first questions that people have been trained to ask. So how did you, it's like the Tesla model of saying the rich guys drive it first and then finance the rest. Is that how it was like early adopters had to pay and now it's less money?
So I very specifically did not want to make it a rich guy thing, because I had like fallen victim to that myself. Like, I was doing well as a surgeon, really well, So I was like, oh, I'll just spend $20,000 for a concierge medicine doctor, and I got nothing, right? And so I did not want it to be like a rich guy thing, right? And so a rich guy or girl thing. So from the very beginning, we priced it so that people could afford it more readily. Okay. And look, you still have to pay for it, right? And so part of what we were educating people on also was that your insurance doesn't pay for this because your insurance only pays for once you get sick. You have to have like the ICD-9 manual, right? You have to have a disease code before you can even bill the insurance. And what we're trying to do is reverse disease and prevent disease in the first place. There's no code for that, And so that's how we got people's head wrapped around like, sorry, the insurance is not going to pay for this. Yes, 50% of the people walk right out the door because they're like, I'm not paying for anything.
Yeah. I paid them thousands of dollars for my health care, right? And it's like, well, talk to them about that, right? Like
it's not healthcare, it's disease care, right? And so I think this is where now people are realizing that what they're paying for is disease care. It's not health optimization, is not maintaining health, is definitely not reversing chronic disease, right? Because there's no incentive to reverse chronic disease in that system. It's much better if you stay in a disease state and your disease gets worse, or you get diagnosed with a side effect or another disease that now needs a new subscription model pill for you to pay for, right?
Offline, we had mentioned this, that you had mentioned that 25% of our GDP goes towards health and the health industry. Is that 25% you said?
Yeah, I think it's like $3 trillion. It's upwards of 20% of our GDP goes towards health.
I honestly, I want to think back to like the War of 1812. Like what percentage of GDP went towards these massive war? I mean, this seems like an exorbitant amount of the resources of a society going towards a system that's not even working.
Yeah. And back this whole problem started probably in the 1940s and 50s after World War II, right? Because now you had these giant industrial complexes that were built that had no war to make money off of. So then they turned into food industry, like pharmaceutical industry, right? And so yes, back in the 1800s, early 1900s, there was a very small portion of GDP that went towards healthcare, right? Because people really didn't need massive amounts of healthcare dollar intervention, right? And so, look, a lot of what happened was a good thing. Like we had tremendous scientific advancements in antibiotics, surgery, anesthesia, cancer treatment. But what also happened was everyone became more sick. So now there was massive amounts of overutilization of this system as well. And so that sickness came, and we now know this, it came from a few things. Number one, we developed this ultra-processed food industry where it became much more profitable to make food out of chemical composites that lasted forever than making real food, right? And so secondly, we went to having light bulbs and shift work. And so our circadian rhythms got thrown off and sleep was no longer a priority. In fact, it was looked as a weakness, right? And then also we became sedentary. We got plopped in front of a computer doing more than 8 hours of sedentary work every day. And then cars, longer and longer distances to get to work from suburban societies to work locations, and so that's additional sedentary time, and so and then stress accumulated, right? So you have this four-pronged attack on our natural biology, what we were built for, coming from all angles at the same time, and that's what made. I think it's 85% or 90% of people now are metabolically unhealthy. 90% of people almost everyone is unhealthy. It's like the flip of what it used to be like back in the early 1900s, where most people were generally very healthy. And then back then there were not, antibiotics and drugs that we have now. So when you got sick, you got really sick and you just died. Now we spend 30 years of our life being unhealthy, 20 to 30 years.
And unloading the net worth that we worked on
exactly
back into a system that feeds on it.
Yeah.
It's really parasitic.
Yeah.
And you think about it that way, it's the perfect way to boil a frog is to make it feel unhealthy and then extract everything to, keep it slightly alive.
Right. Exactly.
So now you're on the good guy side of the team. You've been doing amazing work. I've been down to your clinic in Hollywood. Really, really great experience. So you're now crafting a health wellness optimization experience for people that I think is very unique. And I'd love for you to share that.
Yes. So, basically at Next Health, we have a lot of the therapies that we know have some good science behind them that work well to help people reverse chronic disease and also maintain an optimal state of health. And so a lot of people are hearing about some of this stuff, things like cold therapy, sauna therapy, hyperbaric oxygen, intravenous nutrient therapy. That just kind of like cracks the door open for people, right? I think there's a lot of chatter around it. People are like, where do I go? Oh, that place looks good. It looks beautiful. There's a doctor there. Let me go there and check it out. But what happens is once you come in, the first thing that we do is we measure a set of biomarkers on you. And so for every patient, once you become a member, you get your blood tested. And some people do higher forms of membership where we can actually do full body scans. But at least you're getting your blood and urine tested. With that data at a very low price point, we can find out a lot about what's going on in your biology from a functional medicine and root cause approach, right? Which you don't get in the traditional Western medical system, right? And so then we sit down with people, with one of our medical practitioners, and we say, hey, look, no one's ever told you this before, but look at your inflammation levels, look at your hormone levels, look at your cardiac risk markers, look at your micronutrient levels, your toxin levels, and we can paint a picture for someone on why maybe they're feeling bad, but their doctor has not yet diagnosed anything. Because as we know, symptoms come way late in the process, right? And so we want people to know what their biology is happening before they become symptomatic. And then symptoms then lead to a disease being finally diagnosed. It's completely backwards the way it should be. So we flip that process on its head. So yeah, that's kind of what we do at Next Health. We have people come in, we provide them with the technology to optimize their health, but we first start off with biomarker testing and a doctor to speak to them about their health journey.
Unfortunately, this is how the game has to work, is people just want to feel good and they want to avert pain.
Yes.
So I don't know people that want to, change my lifestyle to be well, but if you have a vitamin drip that makes me feel good, I've heard all about it, right? I heard there's a podcast about how great I felt. So that is the entryway in. It's like the gateway drug, but really lifestyle is the medicine. The medicine
Absolutely.
is and as you mentioned these labs, I want to spend a minute and double click on this, because the way your traditional medical system will look at your labs versus the lens, certain markers that you're testing differently, I would assume, but the lens through which a functional medicine practitioner will look at your blood and your saliva and your urine differently. I just want people to kind of grasp how that is a completely different gestalt.
It's a completely different mindset. Okay. So, and in fact, I was brought up in the Western medical system, right? So we were actually taught not to order labs because they're expensive and they're a burden on the healthcare system until someone has symptoms, and then you order a lab to test for a disease that you think that they might have. It's completely backwards thinking. It's way too late if you're ordering labs at that point in time. And you're also taught to maybe minimize the number of blood laboratories you're ordering too. So then you're kind of handcuffed again into diagnosing something when it's too late. And so what we do is we order a set of 120 different blood biomarkers combined with a few urine markers as well. And your urine is the best way to measure for toxins accumulating in your biology as well, which no one is really talking about in Western medicine right now. And we look at it from a lens of, we know what the root causes of disease are: inflammation, poor metabolic health, hormone disturbances, gut dysbiosis, toxin buildup, mitochondrial health issues, right? Dr. Jeffrey Bland taught us this. Dr. Mark Hyman taught us this many years ago. Now we know how to look for it in your blood and your urine. And so we find it very, very early. And then we tell you what the optimal range is, not the disease range. The disease range is too late. You want to optimize. So I always give the example of hemoglobin A1C. It's a marker of metabolic health. how your body is metabolizing glucose, right? Doctors in the hospital or in a primary care clinic, they notice when it is 6.5 or above, because now you're diabetic and you need to be put on metformin or a whole host of other diabetes drugs. I want to know if it's above 5.2, because once it starts creeping up above 5.2 to 5.3 to 4, 5, 7, we have a problem. We need to go the opposite direction. You want to be as close to 5 as possible on this marker. And then we have other markers that tell us even earlier if you have metabolic health issues, like fasting insulin level, right? And so then if we know that you're headed in the wrong direction with your metabolic health, now we can adjust your diet, adjust your sleep, adjust your stress levels to turn that around completely. And so we're a big advocate also of measuring these biomarkers more frequently than once a year. We recommend quarterly, at least every 6 months, but quarterly is my recommendation, because then you catch things early enough to turn them around.
You've seen, I'm sure, thousands of patients by now through this clinic, and now you have multiple clinics and all this. How long before, I mean, for you it took 8 months and, some pain and grief and all that. How long, now that you have a much more proactive model, and look, you didn't have a guy guiding you. You had to go wander the desert, right? So now how quickly do people start to see, notice, and feel the changes to be like, okay, this is working?
Most people notice changes within a few weeks, like 4 to 5 weeks for sure. Obviously, it depends on how bad things are when we get to them. I would say that almost universally we'll see a change in their biomarkers within the first 3 months, and then a real change in how someone is feeling within 6 months. And so it's very dramatic when you really start focusing on the root causes.
Yeah. I've been in conversations with patients around this because they're like, well, I spend $2,400 a month on my blue policy and this, that, and the other. And we've literally had to sit down and say, okay, look, how much do you pay for cable TV? How much do you pay for this? How much do you pay for that? How much do you pay for Starbucks? And then really, how much do you actually use your blue policy if you're not going to those guys? So can you go to a hospitalization policy and take that $1,200 spread and buy organic produce and maybe a Nora ring or whatever it is, right? And so people just get so stuck in the cost of it that they don't realize they're paying it into the crappy system.
Yeah, absolutely. I mean, the whole concept of health insurance is completely made out of I hate to say it, greed and necessity. Back, what is it now, 60 years ago when this concept first kind of started gaining some traction. And really, insurance is really supposed to protect you in case of a disaster scenario, right? So if we just used it for disaster scenarios, that would be great, right? So your house burns down, you have fire insurance to rebuild your house. But what's happened is people are now using their health insurance to see their doctor on a yearly basis, to get to manage their chronic disease, et cetera. And really what it is just, you're paying into this massive system that everyone pays into to then dole out the ability for individuals to then use the system all the time, right? And so unfortunately, it's become extremely expensive and not really what it was built for in the first place, right? And so I think if we reframe insurance into just using it for disaster care, you get hit by a bus, you get diagnosed with cancer, you have a heart attack, thank God you have insurance, and thank God there's a Western medical system and a hospital to take care of you. Everything else should not be in that system. If everyone got to that mentality, and this would totally unburden the Western medical care system, first of all, because now dollars would go towards optimizing your health and preventing chronic disease in the first place, right? And so I think the first step is really, what I do in my own personal life is I put most of my money into my HSA account and use my HSA account, and I have disaster care insurance, And I had a primary care doctor. As a doctor, I had a primary care doctor for 20 years, right? And all they would do is just keep diagnosing a new disease and giving me more medication. So now that I've turned everything around, I don't really need that.
Yeah, what's he got to do?
Exactly. What's he going to do? Right, exactly. And so I now, use my health dollars in HSA and use it more towards keeping myself healthy. And I'm not telling people don't have a primary care doctor. The best thing, however, is to just reframe how you're thinking, because you really need a healthcare team. You need someone to help you with your nutrition if you're not a nutrition expert yourself. You need someone to help you with your mindset and your mental health. You need someone to help you with your exercise, and that could be a trainer for the most people, or maybe you get educated enough that you can maintain that yourself. That's great. But initially with a trainer, and you need a primary care doctor and some sort of functional medicine practitioner. I'm a big advocate of having a team approach to this.
I like that.
Yeah.
Without getting too far in the weeds, one of the things that I dug up back in the day when I started looking at this insurance model was how they will arbitrage. First of all, it's the sickest people that take all that money, right?
Yes.
But then they will arbitrage our policy money and play it on Wall Street. And the longer they could avoid paying out on claims and hold the doctor's money, they're really making their money on Wall Street. And so all these, it's just this, the whole damn thing is a bit of a Ponzi scheme. And everyone's like, well, I can't live without insurance. It's like, but you can, let's start living without Twinkies, and then everything else starts, shifting. And so I love this paradigm shift, because I think that's where a lot of people are trapped in the healthcare model. It's like, well, I can't get out, I'm going to die. No, your lifestyle is what's killing you. Like, the lack of insurance isn't the problem.
If people knew the nefariousness and the shenanigans that are being played in the insurance world, they would immediately cancel their policy, because it is I hate to say it, but I mean, there's so much badness going on in that world. Like you said, like holding money and playing into the stock market. There's, pharmaceutical companies basically get to negotiate the price that people buy their pharmaceuticals at, because they own the negotiating bodies that negotiate the medicines for themselves. Like, it's just craziness. Like, how does that even happen? How did that happen, right? And so there's a lot of I would say misalignments and badness just going on in that whole industry. It needs to be completely dismantled and just a restart.
Amen. Amen. But and so I spent 5 years of my life trying to do this and swimming upstream and being in boardrooms and talking. Like, I've been in rooms with like insurance people, and I felt like I was on the set of Goodfellas, where I'm like, who are these guys? And so I realized myself that little old Pedram wasn't going to go bust up this Death Star on my own. So then I just started helping individuals and helping people spring the trap. And so we've talked about this offline. I would love for you to talk about what happens when someone turns this corner, what you did, right? And how life starts to change, and how decisions start to change, and how that lens, it's like the goldfish that's in a dirty bowl of water and has never seen clean water, and they clean out the water. All of a sudden, it could be this, right? So I'd love for you to just talk about the experience of how that is for the patients in your life, and how you see that kind of reflect forward into their lives.
So I have this one patient. I'll give you an example of a patient. So she was, I would say 45, 46 years old, had gained 30 pounds after menopause, and was developing a thyroid disorder, okay? And saw endocrinologist after endocrinologist, a thyroid surgeon, and everyone had just given her like a sentence of like, look, like, you have PCOS, you have Graves' disease, you have name like 7 different diseases, right? And they just said, you're got to go on disability, right? And so she was filling out all the disability paperwork and was about to go on disability. And this is a woman that had a high-powered career as a corporate executive for a long time, was at the top of her game for many, many years, was earning an incredible living and living a great life. And then menopause hit, and everything shifted, and they were going to put her on disability. Same thing, like, she was on antidepressants and anti-anxiety medications, all these things. And she came to see us, and we did our normal process. We, did a biomarker panel on her. We noticed a few things that needed to be corrected. The number one thing that was happening was inflammation due to leaky gut, right? And because she was, diagnosed with this thyroid problem, she became depressed and started eating a lot of ultra processed food, a lot of garbage basically. And we just stopped all of that and just tweaked her diet, protein first kind of a diet. And we did a few manipulations of her hormones as well through some hormone replacement therapy. And we also put her on an IV nutrient regimen because we noticed that her nutrient levels were in the toilet. Like B12 was almost like at disease levels. And so we just got her spruced up really quickly, just a couple of IVs, And within a month, she started feeling so much better, completely changed her perspective. She threw away her disability paperwork. And now a year later, she climbed another rung at her company. I mean, if I said her name, she's famous and you would know her. But it completely saved her career. She was about to go on disability at the age of 40-something. And this completely put her back into the game, top of her career, and she's super happy, right? And so, like, once you wipe the lens clean, like you said, just with some minor changes, and we like to have some quick wins, like, the IV therapy, she just felt great. She had her energy back, like, quickly. So it was good for just our psyche to have a few quick wins that are easy and not super expensive, but then while you're making some big change, right? And so that's kind of the pattern or the kind of model I use with some of my patients.
Let's ride that B12 IV therapy into the corral here because you found an incredible amount of dysbiosis in this individual.
Yes.
So while you're trying to spend 2-3 months fixing the dysbiosis, you give the B12, they feel better. This is how you're supposed to feel. But then you fix the microbiome and the dysbiosis, and guess what comes from healthy gut bacteria and healthy. So, like, I would love for you to just...
You don't need the IV therapy forever, right?
That's it.
Your body knows what it needs. You just got to give it to it, and you got to fix the mechanisms by which it can absorb it and turn it into a usable form. Some people have a genetic. She actually had this too. She had an MTHFR, genetic.
Methylation pathways stuff.
Yeah. I don't like to call them. I don't like to call it like a genetic deficiency. It's just a SNP, right? She had MTHFR SNP, and so we just had to give her a different form of vitamin B, and so that she's immediately felt better. And so now we knew, and then we fixed her gut, and then now she's off to the races. And most of her, she's on very few supplements. Like, she's mainly just doing this with nutrition and lifestyle intervention now.
So that's an important point. I just want to kind of double click on it. It's like, so most people are like on cyanocobalamine, and then people are just like, oh, it didn't work for me. And you switch to methyl, right? And then boom, oh my God, that's what I need. It just took looking at the genetic SNP, which again takes a doctor who looks through a different lens for a moment to understand the difference. And again, that's education. Thank you, Jeff Bland. Thank you, Mark Hyman. Thanks for the education on this.
Right.
Gut is a big lever. I talk about it a lot. Obviously, you and I talked about it offline. You mentioned another of the big levers that I think isn't talked about enough, which is toxicity.
Yes.
How much of this are you seeing? How much of this is impacting mitochondrial and cellular health?
Yeah. So this has now become, in my mind, a fifth leg of the stool. Okay. So you have nutrition, exercise, sleep, and stress and emotional health as 4 legs of the stool that we all know we need to optimize along. This is 100% just as important as all of those other 4 now, because we live in this earth now that has now been polluted with 150,000 different toxins that were not here 60 years ago, right? These are all man-made chemicals that have been put into this environment that are going to be here, many of these forever. Like, they are not going anywhere. And we are now exposed to these. They are in our biology. They're in our organs. They're in our bloodstream. They are being passed through the placenta to infants that are now being born with 70, 80 different chemicals in their umbilical blood. It's crazy. It is all around us, and it's everywhere. And we test for this in the urine. We have a total toxin screen that we do on people that tests for 130 different toxins. And we see it. We see microplastics. We see glyphosate. We see heavy metals. We see, you name it, 100% of people in our practice have some level of toxic exposure that is in more than just the, green range. It's in the yellow or red range. So there's a reality that we live in. And I think we need to be extremely cognizant about it, just as cognizant as we are about what we're putting in our mouth and how much sleep we're getting and how much exercise we're getting.
So a lot of people hear this and go to this place of hopelessness. Of like, oh man, it's all over. We ruined the planet, boo. And so I'm going to put one side of this equation and say, look, I just did a whole series on this.
Yep.
You can get air filters, you get water filters, you can control the inputs. We have a saying in the martial arts, I don't care how good you are, if you stand in the ring long enough, you're getting punched in the face.
Yes, exactly.
Right? So you got to stop the inputs. Now, from there on, doctor, what do we need to do to get this crap out of the system so that when we minimize the inputs, now we are less toxic?
Yes, exactly. So the key is the Pareto principle, right? What are the 20% of things you can do to get 80% of the result? That is definitely minimizing the inputs. I just want to double click on that. And you have a great series on this, right?
Just finished a series on it, but I mean, it scares people. This stuff scares people. My home isn't safe. The world isn't safe. So it's like, no, air filter, water filter. Like, look at these few things.
You can get very safe, even if you're living in an urban environment. You can get much safer than most of the people are. But to answer your question, yes, there are ways that you can detoxify your system right now. And so there's things that you can do for free. There's things that might cost you a little bit of money. And there's things that cost more money, right? So things that you can do for free is just sweat, just get out there, go for a run. Sweat helps you eliminate toxins. Get your gut health in order, stop eating ultra-processed food, eat more fiber. Fiber is excellent for helping you detoxify your system. Your liver is the organ of detoxification, your liver and your kidneys. Give your liver what it needs to help you detoxify. And so that is, first of all, avoiding alcohol. If you do drink alcohol, I never tell people stop drinking alcohol because it's hard. It's a hard bar for people to climb. So I say, give your liver a break period where you can just detoxify. Don't drink for like 4 days in a row. That is extremely helpful. There's certain products out there that can help your liver function more optimally. So, you and I both, you come from a Taoist, a Chinese medicine tradition, and I come from Ayurveda. We know there are thousands of plants out there and herbs that can help your liver function extremely well. I love this product called Deliverance that I take have you heard of Deliverance?
Oh, yeah.
Every day I take a Deliverance. There's also some things that might cost you a little bit more money, right? So things like getting a sauna or finding a place that has a sauna. A sauna is a great technology. I think there's going to be a world where everyone, just like you go to the gym 3-4 times a week, is part of your routine. You got to go to the sauna 3 or 4 times a week. There's so much evidence around this, Then there's some supplements that are also extremely helpful in detoxification as well. And just, part of detoxifying your system is giving your mitochondria the energy it needs to help you detoxify, right? And so there's supplements that help your mitochondria function optimally, like urolithin A or nicotinamide riboside. These are all supplements that I take, or I consider them foundational now, And then lastly, what I would say is there are some modalities that we have in Next Health now that I'm really excited about. Things like plasma exchange that we're doing. And this is more expensive and it's not for everybody, but it's proven to be extremely useful in people that have dangerous levels of toxic buildup. And we're trying to drive the cost. Like I told you, we're trying to make this more accessible for people. And the more we grow and the more time passes, the more accessible this stuff will be. So plasma exchange is something that we use. It's kind of like an oil change for the body. We remove your blood, put it through a massive centrifuge. We separate your plasma from your blood cells and give you back your blood cells. And so the plasma is where these toxins live. And so it's like a massive reset at one moment.
So you're taking out the trash at scale through the pipes. That's interesting.
Yes.
Now, a lot of people go, like I've done this stuff. Like I think Mark Hyman sent me to some guy up north where I did a 10 pass. And you do all this chelation and all this, and you've tried it all. How much of that has proven to be effective in your clinical experience? How much of that do you guys do here? I mean, a lot of folks swear by chelation. A lot of doctors say it's dangerous, it's done right, it's done wrong. I just want to get your perspective on it.
So, chelation is something that I have done in the past as a practitioner. We don't really do chelation in Next Health. because I only reserve it for the really refractory cases of heavy metal buildup, right? And so we can normally get people detoxified from heavy metals by using other modalities. And so I'm not using chelation a lot. I think you talked about 10-pass EBU. We do 10-pass as well. That creates a small amount of oxidative stress in the body that helps to eliminate certain toxins. And also, if you have mold exposure, it can be very helpful. We found that to be extraordinarily useful in people that are dealing with certain types of toxic exposure, mold being one of them. And then I'm a big believer of N of one, which means that you are your own individual science experiment, right? We can look at massive studies as much as you want to. They're only going to report what's happening on the average of a bell-shaped curve. And so there's always people that fall on the outsides, right? 1 or 2 standard deviations away from the middle. And so there's some people that a particular therapy might not work at all and might actually be dangerous. And there's some people that it works extraordinarily well, even better than the average. And so I'm a big believer in testing biomarkers before and after the procedure and seeing how much we move the needle for you. And if we don't move the needle for you, the procedures we do are extremely safe, but you don't move the needle, you still shouldn't do them. But I've seen massive changes in people, even just with one session of plasma exchange, and then we continue, and then we get better and better and better on certain people.
Yeah, and listen, it's either going into the broken medical system and paying for drugs for life, or just cleaning up your blood and putting you back into the race.
Or worse, paying for cancer therapy, right? Radiation, or paying for it in your life, like you said earlier. A lot of toxins. The biggest problem with toxins is that they are a root cause of all diseases. So that means that just like having diabetes, for example, you have an increased risk of Alzheimer's, you have an increased risk of cancer, you have an increased risk of autoimmune disease, you have an increased risk of heart attack, everything bad. So you're causing yourself with high levels of toxins in your blood, in your body, you're causing yourself to deal with chronic disease for a lifetime,
I often think I can't afford to be 0.8 me. And as much as I optimize, I might be somewhere around 0.85, 0.9 me. And maybe I just don't, my limitations are my belief systems, and quantum biology is going to change all that. And I'm going to, I'm maybe 0.2 me, and I'm just, being a fool right now. But if you had the multiple diagnoses that you had pre your awakening, what would you say? Well, you were 0.3 you, 0.4 you, right? Like what diminished version of yourself was functioning at a suboptimal level and wasting those heartbeats, right? And that is the currency of life itself that I think people don't get in this healthcare deal.
Yes, absolutely. Yeah, I mean, I kind of felt like I was, to use your model, 0.3 me, I was pretty bad. 0.1 I would consider as being like a frail elderly person maybe, but I was getting close. I have a hard time walking from the parking lot up to, the second floor surgical suite without joint pains and huffing and puffing. It was pretty bad. Yeah.
And that guy doesn't appreciate life because he's too busy sucking wind.
Absolutely. You're living at, 0.3, 30% of the life you could be living, but also to your point, you're wasting heartbeats, right? You spend so much time dealing with these problems that you don't have that time available to you to live the best life you could.
Amen. So I'd be remiss to not talk about this, because I know you're such an advocate for this kind of emerging science, quantum biology, and some of the implications that are coming with this new science that everyone should be looking at. I would love to get your perspective on it.
Yes. So, what's so interesting about this is people have been talking about this for 30, 40 years, 50 years, and getting completely poo-pooed. And now that we have much more clarity of thought around quantum, we are seeing a kind of a resurgence or a renaissance of this field of science, right? And it's it's exciting. We talked about this offline. It's really exciting. So a few things that are really exciting to me is we have Google, for example, and many other institutions now that have quantum computers. These things now exist in reality. Quantum computers exist in reality. So computers are accessing the quantum to solve problems that would take hundreds of billions of years in a few minutes now. This was recently done a couple of weeks ago. So now we also know that there are structures in our biology that also function on a quantum level, right? And we've had the technology within us all the time to access this incredible computational power. And now that we realize this, we are able to now dive into more of the science around how we can modify this quantum biology to affect change in our own biology at this moment in time. And so I think this is extremely exciting, super new. But what I really love about it is that all of us have this power within ourselves right now, right? And you don't need to go to a doctor or go to a guru or go to someone to tell you how to use this. You just have to read about it yourself and just practice it, right?
Amen.
Which is awesome.
Amen.
Yeah.
And honestly, like with this emerging field, the implications of what you can do by just living in a space where you can access it can change your neurophysiology, can change everything, right? And so I just think that there's a lot of excitement that is emergent. Like, I think we had to break the healthcare model and create a new one, right? Like we had to come to Plymouth Rock to start the new deal. Yeah. And now that that's happening, I'm seeing all these green pastures kind of popping up everywhere.
Right.
It's like fresh renaissance of thought that is actually not so novel. I mean, maybe the sadhus of the past have been talking about this for a long time, but it is emerging into really interesting areas where we can help people and help ourselves and change the way we think and all of it. So
yes,
I'm a really big fan of what you're doing here. Tell people where they could find you. If you can get access to this kind of healthcare, get it, right? So please share where people can find you.
Yes. So I'm at, my website is drshah.com, drshah.com. I'm on all the socials at Darshan Shah MD. And then I have this clinic practice, Next Health, is at next-health.com. And we're opening all over the United States. We're in Dubai and we're also in Canada. So we're trying to grow, but there's a lot of great, functional medicine practitioners out there that people can find that can help them kind of get started on the journey. And then I think a lot of it has to come from yourself, just learning, incorporating, developing good habits. And those habits will build up over time and you stack them and you're going to make massive change. That's what I did.
I love it. Yeah. So just someone who's listening to this is like, oh, well, he found his why because his son was born. He had this magic moment. Someone who is on the precipice of saying, well, I got to change the way I do things. What would you say to them to find that why? Yours was a son born upstairs and an article open when you had a donut in your mouth. Like that was kind of like a dong on the head, right? So how do you help people find that why?
I think it's critical to find your why. I think you sit down until you find it. If you can't develop something that's compelling enough for you to have this why, there are definitely professionals that can help you find your why. There's courses you can take. Go on that journey first. I think it's really, really important. There's even workbooks that you can get from incredibly smart people on Amazon that can help you find. You have books that you can read on finding your why. I think it's the step one in the whole journey, because without that, you'll just have a lot of stop and goes,
Yeah, you'll be at 0.3 you. And that's not, you don't deserve that, your children don't deserve that, and the world doesn't deserve that of you.
Mm-hmm. Exactly. Well said.
This was great. I really appreciate our time.
Thank you, Pedram. It was great being here.